All right, if you're a hospital leader in Maine, the next few minutes might just be the most important you spend all year. We're about to break down a massive shift in healthcare funding, a change that's both a huge opportunity and, frankly, a pretty serious threat. Okay, let's get right into it. This is what it's all about. Just before the new year, Maine was awarded over $190 million in federal funds from the new Rural Health Transformation Program, or RHTP. Now, that is a ton of cash, but it's not a simple gift. Where this money comes from, and maybe more importantly, why it's being given, well, that's the real story here.
So is this a lifeline? You bet it is, but it's a lifeline that comes with some very specific instructions. This is not money to just plug holes in your budget. This is funding to fundamentally re-engineer how you deliver care before the old model is gone for good.
And this slide, wow, it lays out the challenge perfectly. See, the very same federal act that gives Maine this $190 million also kicks off a permanent cut in Medicaid that's projected to cost our state's health system $5 billion over the next decade. So this money isn't a bonus, it's a structural adjustment fund. Think of it as a 5-year bridge to get you across a chasm before the old road collapses entirely.
So, here's how we're going to break this all down. We'll start with that double-edged sword, then we'll get clear on the federal rules of the game. After that, we'll dive into Maine's specific plan, show you exactly where the money is, how to apply for it, and finally, we'll weigh the big strategic risks against those long-term rewards.
Let's be absolutely clear about this new landscape. The RHTP is designed to force a transition. It's temporary, targeted funding to help you adapt to a permanent new reality of less traditional Medicaid money. The goal is to get your hospital from the old fee-for-service model to a sustainable, tech-savvy, value-based care model, all before this grant money runs out.
To win a piece of that $190 million pie, you have to understand the federal architecture. Think of it like the rule book for a brand new game. And the hospitals that learn these new rules the fastest, well, they're the ones that are going to get the funding and thrive. So let's break down those rules.
Now, what's really interesting here is how the money is split. Track 1 is a sure thing, about $100 million for Maine, which is a nice stable baseline. But Track 2, that's where the battle is fought. This is competitive money. Maine got about $90 million from this track in year 1, but to keep winning, the state needs powerful data from you. Data on your risks, your workforce shortages, your community's needs. Your data helps Maine win at share.
And here come the strings attached. Of course, there are strings attached, right? The federal government has tied a big chunk of this funding to the state adopting certain policies around lifestyle and prevention. Now look, whether you agree with these policies is, for funding purposes, irrelevant. The crucial takeaway is this: grant applications that clearly line up with these priorities, think food as medicine initiatives, are going to have a much, much better shot at getting funded.
So that's the big picture from the feds. Now let's bring it right back home to Maine. The state has taken that federal guidance and sorted its $190 million investment into 5 strategic pillars. Any project you pitch has to fit neatly into one of these categories. These are your funding buckets.
Now, based on the state's plan, here's a rough idea of how that money might get sliced up. A big chunk goes to an uncompensated care pool for some immediate stability. But just look at the other big slices. A massive $40 million for a Health AI Innovation Institute and $30 million for population health pilots. That tells you everything you need to know about where the state's focus is: technology and prevention.
Let's dig into that first pillar, population health. This is all about moving upstream, tackling the root causes of health problems instead of just treating symptoms. We're talking funding for things like mobile health units and school-based centers. You want a slam-dunk grant opportunity? Propose a project that proves your community paramedicine program is reducing costly hospital readmissions. That's a guaranteed winner.
Now for Pillar 3, technology innovation. This is the real research and modernization engine for the whole program. The centerpiece is the creation of a statewide Health AI Innovation Institute. This is where the money for things like AI scribes, remote patient monitoring, and robotics is going to flow from. Your immediate action item, like your do this tomorrow action item, contact this new institute and get your hospital on the list to be an official pilot site. You have to get in on the ground floor.
Okay, so you know what can be funded, but where do you actually go to get the checks? It's not just one big pot of money. We need to look at 3 different faucets, and each one needs its own strategy.
And before we look at the specific sources, let me share a pro-level strategy with you: braided funding. This is how the really sophisticated hospitals are going to maximize their awards. It just means strategically combining funds from different sources to cover different parts of one big, ambitious project. It shows reviewers you're resourceful and you've got a solid plan. Here's a perfect example of how it works. Step 1, you apply for a grant from a private foundation, like the Maine Health Access Foundation. You use that money for the soft costs, all the planning, the governance, designing the protocols. Then in Step 2, you go after the big RHTP federal grant to pay for the hard costs, the technology, the equipment, all the hardware. Just like that, you've covered your entire project from 2 different sources.
So who can apply? Well, the usual suspects are on the list: critical access hospitals, FQHCs, and so on. But here's the real strategic secret sauce. CMS is giving much higher scores to what they call network applicants. A solo application from a hospital is good, but a joint application from a hospital, a local mental health agency, and the school district, that's great. It shows you're deeply integrated in your community, and it's going to score way higher.
Now for the most practical part of all this, your playbook. We're going to walk through the exact timeline and the immediate action items your team needs to get on, like right now, to be ready for the next funding cycle.
Here's the projected timeline, based on how things went the first year. So go ahead and mark your calendars. But I want you to circle, star, and highlight one specific 2-week window, the public input period in late September. This is your chance to advocate directly to the state. If you want them to fund a specific type of project, you have to submit comments during this period to get it into the state's official plan.
So what can you do right now? 3 things. First, form a transformation steering committee with your key leaders. Second, do a brutally honest audit of your data capabilities. If you can't easily report on outcome metrics, your first grant proposal absolutely must be for data infrastructure, period. And third, like I mentioned, get on the phone with the new Health AI Innovation Institute today.
We've covered the huge opportunity. Now we need to talk about the risks, because going after this RHTP funding isn't just about filling out a grant application. It's a profound strategic choice about the future of your hospital, and it has some serious pitfalls if you don't manage it carefully.
The single biggest risk is what we call the solvency cliff. Remember, this grant money is temporary, but the Medicaid cuts are forever. If you use these grant funds to hire, say, 10 new permanent staff, what happens in 2030 when the grant just ends? You fall off a cliff. The strategy to avoid this is clear. Use this money for one-time capital investments, technology, renovations, and to pilot new payment models that can sustain themselves long after the grant is gone.
So really, it all boils down to a very stark choice. On one hand, there's the risk of doing nothing, just clinging to the old model and driving straight towards that fiscal cliff in 2030. On the other hand, there's the reward of transformation, using this 5-year window to build a truly modernized, sustainable hospital that's ready for the next 20 years. I want you to let this quote from the source analysis really sink in. This isn't about getting a grant. It's about participating in a structural adjustment. The federal government is giving you the tools and the temporary cash to rebuild your engine while the car is still running. You simply cannot afford to miss this opportunity to retool.
And that brings us to the final, unavoidable question. The money is on the table, the roadmap is clear, and the clock is ticking. You have a 5-year window to leverage this historic investment and secure the future of your institution. So let me ask you directly, is your hospital ready to transform?